skills that is exceptionally difficult for those of us who have chronic pain is something called radical acceptance. Now, those of you who know me, right? I think that's everyone here. That's you anyway. Know that I'm a physician who's gone through a lot of mental health treatment myself as a patient because of various things like MDD, PTSD, and other illnesses, right? And along the way on this journey, I have been taught something called radical acceptance from dialectical behavioral therapy. Dialectical behavioral therapy has a lot of good evidence for it, and I have shown some of the studies in the Relaxation Club list where I just straight up said the studies, which you can get in the descriptions of most of my YouTube videos if you're not part of that. But in general, you can look up dialectical behavioral therapy on PubMed.gov or any other, research site that's, medically legitimate, and you should be able to find it there. Radical acceptance is tough because it means that instead of judging an experience that's painful or unhappy, what we would usually call a bad experience, you recognize that it is what it is and move forward into how to do the next thing, right? That's extremely difficult. Don't be sorry. Don't be sorry, you. I'm happy just to have you here. You are such a special member of the community, and I'm glad to see you. I hope you don't mind the head scratches. I'm going very slow today because I am kind of loving these sounds, aren't you? I hope you are anyway. Okay, so an example of radical acceptance. I have chronic pain all the time, and one thing that hinders people with chronic pain can be avoiding activities that are necessary for function in life because they cause pain. Now, on the one hand, you don't want to damage something further, right? So if you have a ruptured disc or, a broken bone, right? You don't want to be doing more on that and making it worse. But on the other hand, if you've been worked up and you have chronic pain, even if you have to adjust your motion or change how you do things, you don't want to let it end your whole life. What's tough is accepting that for now, this is a new normal. I don't know if you've seen the other video I did on radical acceptance on the channel, but there's a moment in there where you can see I am really struggling with the concept. I think it's either the one about techniques that have helped prisoners of war, or it could also be the one about it's like 7 or 4 psychological techniques for pain psychology, something like that. And it's when we get to talking about radical acceptance, there's just this moment where I am suddenly very hesitant, and I begin to spiral into talky talk, trying to rationalize it, right? That was a year ago, I think, that I've last talked about radical acceptance on the channel. Thank you. So that's what radical acceptance is. Another good example of it is, I just put up, or on Tuesday, they'll go up a short video on the Becoming a Real Life Superhero channel, where it talks about people who have no limits in martial arts. Just these amazing people like, a wrestling champion that's missing a leg, another one that's missing the lower half of his torso, a BJJ expert who doesn't have any fingers on one of his hands. He was just born that way. Another gentleman who is blind and also is missing fingers from an explosion, accident, something like that, right? And we would say radical acceptance in DVD is, we would say, rather than just wishing, okay, I wish I had a leg, it's really frustrating that I don't have a leg, this is unfair. You accept that this is the case, and then you work with it. And in the case of those wrestlers, it's actually harder to grab onto someone if they have less limbs. So it actually ends up being an advantage in competition. I wonder if this is dead. So that is, that's radical acceptance. I think our LED might be dead. That's very sad. These are supposed to last a very long time. So, I'm going to radically accept that this is the way it is and move on with the stream. We'll mourn the lost ring light. That is a terrible bummer though, because I wanted to record a bunch of cool stuff this weekend, or this next week. Well, so that's what radical acceptance is. One exercise that you can use to try to help yourself on the journey to radically accepting your situation, which doesn't mean that you don't try to change the things you can change. What it means is that for now, you move on and do the things that you need to do. Okay? Oh, I have to sit very low if I want the green screen to work. Look at this, isn't this silly? If I'm up, it doesn't work. Hello, I'm short. I am short. Do you work now? That's very silly. So the exercise that I want to show you is called judgment diffusion. It kind of helps you to let go of your judgments and other obsessive thoughts, right? And you guys have seen me struggle with this, right? There have been entire streams where it's like an hour or 2 hours, and on the one hand you want to obtain perfection, you want to do a good job and make things good, but sometimes for now you have to let go, accept that this is the way it is, and move on. You guys have seen that's a challenge for me. So that's so the judgment diffusion exercise kind of helps with that. There's a basic mindfulness exercise that I think we've done before on the channel, where you do like thought diffusion using your imagination. I don't know if you know what I'm talking about. Do you know what I'm talking about? Yeah, like you said, it is what it is, kind of. I know a lot of people who hate that phrase, and sometimes I hate that phrase because it's like, yes, of course it is what it is. What else would it be? Hi. if you're experiencing severe distress, please do that. So, thank you. I appreciate that. That's a nice compliment. I think my husband thinks so too, sometimes. Not all the time. It's all filters. It's all fake. It's tricks. It's okay if you have questions about not relevant topics. That's okay too. That's totally okay. That's also okay. Let us darker. I don't know if you can. They can wait till later. Oh, I am almost see-through now. I didn't mean to do that. My apologies. I didn't mean to fade into the next dimension. It's a tough thing, you know, being the owner of a magic library. It is very easy to accidentally fade into the null dimension. I'm back. I'm back in this plane of reality. So I can touch your head and whisper in your ears. I do try to be transparent with you, that's true. That's very funny. You're very funny today. Alright. Are you ready for the exercise? Okay. The object of this exercise is to visualize your judgments either as pictures or words, harmlessly floating away from you without obsessing about them or analyzing them. One of the reasons that sometimes when you're in a lot of distress, CBT exercises don't help is that you are in too much emotional distress to actually sit down and coolly really process things. And as a result, you can't really do the exercises for cognitive behavioral therapy where you answer your thoughts and put in, correct the things that are not true. Correcting your thinking, thought distortions and so forth, right? Cognitive behavioral therapy really gets in and fixes things under the hood. But you can't do that unless you're in a good state of mind, right? I'm gonna take this hat off. It's making my head too hot. So, it's extremely effective for depression, but a reason DBT is more directly effective for suicide is because it helps to get you to that place where you can stop and think, right? A couple of the studies that I looked at didn't show DBT having a lot of benefit exactly long-term for like depression or how people reported their long-term mood, but it has a lot of benefit for sorry, my back hurts. I'm trying to find a good position for getting to you where you can fix those things. It's excellent for preventing self-harm and suicidal ideation. So, or at least acting on suicide, right? So that's good. So, you're gonna picture those thoughts, and instead of directly analyzing them, unfortunately I have to lean in here. Sorry. I remember how at the beginning I spent half an hour trying to figure out how to sit. It's because sitting hurts right now. Okay. So you're gonna imagine your thoughts, and you're gonna find a way to let them harmlessly float away. Whichever way you choose to do that is understand. I have seen young intern therapists misunderstand this technique. Okay, technique, not technique. I've seen them do it where it's like, okay, you're not allowed to have any moral beliefs anymore, basically. And that kind of extremism is why some people don't feel comfortable seeking out therapy, because they think it means they have to become like, as Jason Todd said in yesterday's video, like granola yoga people. I love yoga, and granola's not bad either. But you are allowed to have your beliefs, and certainly there are some things that are bad. I knew a therapist who said you should never be angry up to a 10 about anything, and I was like, well, I think being raped is something you're allowed to be angry up to a 10 about. I think so. Like, you know, or if something's happening like that to someone else, right? So, I don't want you to misunderstand me when I talk about letting your judgments flow, and think that I mean it's okay if something terrible has happened to you, or it's okay that you're not allowed to here as a handout, because of course it would be kind of bad if I give you the whole thing. That would, you're allowed to give up to 10% of something for educational purposes. And so this is definitely for educational purposes. Your hair is fairly lovely today, by the way. I like touching it. So what I was saying is you can take the workbook, those pages that I gave you, and there's 2 special pages in there. One of them is a beginner's mind sheet, and the other one is a judgment record. You can use either one of those to write out the judgments that you find yourself making during the day, so that you get a good idea of what your snap instincts tend to be. And don't judge your judgments either, right? You're going to write down, for example, basically anytime you think something is bad or good, either one, like any judgment, and you'll write them down. But you probably already right now know some that you make, right? Like if you've chronic pain, like a snap judgment that I have is, right, this sucks. Like, it sucks that I cannot find a way to be careful, to be comfortable when I sit. It sucks, right? You see how that slows me down? In my case, because of the severity of the fibromyalgia with the MDD, it will literally, like a snap judgment like that, will literally like slow me down and make my brain unfocused, right? Because it brings the attention of my brain back to what's going on in my body, which is pain. Pain is what's going on in my body. So the snap judgment of that sucks is not helpful. I do the best I can to find a good position, but I can't do that forever, right? I have to move on and do things with my life, right? So, that's like a snap judgment. That sucks, right? That's a negative estimation of the situation. Similarly, my, ring light that I use for all of my recording broke. That sucks, right? That sucks. The negative estimation is not so helpful. But again, like I said, don't judge the judgments. They're not necessarily bad or good. It's the question of whether or not you can actually use them right now, right? I accept that it's broken, and then that when I get a chance, I will figure out how to fix it, right? But right now I have to accept that it's broken. That's an example of like working through the exercise. I hope that makes sense. Let me know if it doesn't. Are you confused? Do you have any questions? You are welcome to ask any questions that you like. Alright. So I'd like you to think of some of the judgment that you might have, right? Or you can come back to this exercise. I will make sure that it's saved. And you can like take a note of when. So this is, I don't know how far this is into the exercise, but you will know. You will be able to look and see probably. Take a note of when this part of the exercise begins and come back to it after you have a list of the judgments that maybe you make. But I'm sure you can think of some right now. Okay. So as the fire drops little sparks into the air, they appear and then they disappear into the rest of the flames. Perhaps your judgments are like that. I would offer you some of my tea, but I have a little bit of a sore throat, so you'll have to drink your own. If the judgments come very quickly, do your best to watch them all disappear without getting cloaked on any one of them. Folks who have ADHD or racing thoughts might notice this, right? Some people with bipolar disorder also have racing thoughts that can make things appear and disappear like that. Continue to breathe and watch the judgments come and go until your timer goes off. When you finish, take a few slow, long breaths in, out, in, out. When I was in very intensive martial arts as a kid, when we breathed in and out, we would use our hands in and out, using maximum power and strength in the hands. This is why this was a martial arts technique. You were actually building muscle strength at the same time. You pull in and you breathe out. Push it out, strong and steady, without your hands shake, in and out. And then slowly open your eyes and return your focus to the room. There we go. What do you think? Did you do it right? Maybe scooch a little closer to you if that's okay. Because I think I'm only going to make my back happy if I make my legs happy. Or maybe what I need to do is scooch even more this way. But what do you think? What do you think of that exercise? Did I put you to sleep? That's not a bad thing, if that happened. I hope you liked that. If you did, of course, there's many more